All right, everyone. At your next visit, you'll be 28 weeks. You've officially entered the third trimester, which means we're getting closer to meeting that little human you've been growing. This visit is kind of like a checkpoint in your pregnancy journey, where we check in on how you're doing, look ahead to what's coming, and make sure your body has everything it needs for the next stretch. Today, we'll talk about three main things. First, some important blood testing, because we like to know what's happening under the surface so we can plan ahead for the best possible outcome. Second, we'll go over isoimmunization and ROGAM, what it is, why it's offered, and who might need it. And finally, we'll briefly dive into VBAC, or vaginal birth after cesarean, so you can understand your options and feel confident making informed choices. So grab your water, take a deep breath, and let's walk through what to expect at this milestone visit, because week 28 is where things start to get real and really exciting. All right, let's start with everyone's favorite part of prenatal care, more blood work. I promise, it's all for a good reason. At your 28-week visit, we'll be checking a few key things in your blood to make sure you and baby are staying healthy as we move into the home stretch. First up, we run a complete blood count, hemoglobin and hematocrit, and ferritin. These tests give us a full picture of your iron levels. Iron is essential for keeping your blood strong enough to carry oxygen. Basically, we're making sure your tank isn't running on empty. Next, if you're Rh negative, we'll do a second antibody screen. This test checks whether your body has started making antibodies that could affect your baby's blood cells. And finally, we start preparing for the gestational diabetes screen. Before you leave this visit, we'll give you a little packet called Fresh Test. It's a powder you'll mix with 10 ounces of water and drink before your next appointment. Just remember the time you finish it, because 1 hour later, we'll draw your blood to see how your body handled the sugar. These labs give us a really good snapshot of your health going into the third trimester and help us catch any issues before they become problems. Now, let's talk about iron, because this tiny mineral packs a serious punch when it comes to your energy, mood, and birth outcomes. When we check your blood work, we're looking to make sure your numbers fall within healthy ranges. Here's what we like to see: a hemoglobin greater than 12, a hematocrit greater than 36%, and ferritin, which measures your stored iron, ideally sits between 125 and 350. Other tests might include vitamin D, which we like to see between 125 and 175, vitamin B12, which should be between 200 and 800. Now, if your ferritin drops below 30, that's considered a critical iron deficiency, and that needs attention right away. We offer IV iron here at the clinic. Low iron doesn't just cause fatigue or dizziness. It can increase the risk of postpartum hemorrhage, impact your milk supply, and has even been linked to higher rates of anxiety and depression. Higher anxiety in pregnancy has been linked to oral ties, and when iron deficiency is significant, it may also affect baby's neurological development. So keeping levels healthy matters for both of you. Here's the tricky part. Iron absorption can be a bit of a diva. Certain foods and drinks block it. The compounds in grains, legumes, and bran, unless fermented like in sourdough, oats, tea, coffee, cocoa, leafy greens like spinach, believe it or not, dairy, and even soy. To make it even more interesting, your body can only absorb about 60 milligrams of iron at a time. And in the early afternoon, your liver releases an enzyme called hepcidin that shuts down iron absorption altogether. So timing your supplements really does make a difference. The takeaway? Iron is essential, but it's also a little high maintenance. Knowing how and when to take it and what to pair or avoid can make all the difference in keeping your energy up, your mind clear, and your body strong for birth and recovery. Remember that fresh test packet we talked about earlier? That quick sugary drink and the follow-up blood draw help us check how your body is processing glucose. Basically, how well your system is managing the extra energy demands in pregnancy. About 6 in 100 pregnant people are diagnosed with gestational diabetes, making it something we want to stay ahead of. There are a few factors that can increase your risk, including being over 25 years old, having a BMI above 25, a previous history of gestational diabetes, or having a baby over 9 pounds, high blood pressure or heart disease, PCOS, pre-diabetes, or a family history of diabetes. Certain populations also have a higher risk. Those who are Black, American Indian or Alaska Native, Asian, Hispanic or Latinx, or Pacific Islander. Now, why do we care about catching it early? Because unmanaged gestational diabetes can increase risks for both the birthing parent and the baby. For you, that might mean a larger baby, shoulder dystocia or birth injury, high blood pressure or preeclampsia, depression, preterm birth, stillbirth, or a higher chance of cesarean birth. There's also a chance that a clot will form in the umbilical cord. For baby, it can cause respiratory distress, jaundice, and increase the likelihood of obesity or diabetes later in life. The good news? There's a lot you can do to help keep things in balance. A diet focused on whole foods with protein and good fats, and light exercise 5 days a week can make a huge difference in blood sugar control. Sometimes medication may be recommended, but often nutrition and movement are the most powerful tools. Now let's talk about isoimmunization, also called hydrops fetalis. It's an irreversible condition, which is exactly why prevention matters so much. Here's what happens. Antibodies from the birthing parent cross the placenta and attack the baby's red blood cells, destroying them. If the baby survives, they often need blood transfusions until their blood stabilizes. This destruction can cause severe anemia, jaundice, brain injury, swelling, heart failure, and even death in up to about 10 to 30% of cases. That's why RhoGAM is so important. It's given at 28 weeks, within 72 hours of birth, or after any situation where blood could mix. RhoGAM prevents the body from developing antibodies that could attack an Rh-positive baby, both now and in future pregnancies. RhoGAM is a blood product derived from human plasma, and there have been no known cases of communicable infections from its use. RhoGAM turns a potentially life-threatening condition into one we can almost always prevent. All right, let's talk about VBAC, vaginal birth after cesarean, because once a cesarean doesn't always mean always a cesarean. Here's what to expect in our practice if you've had a previous surgical birth. We'll start with a consultation with our collaborating family practice OB and request your surgical report to review details of your prior birth. For those who have had 2 or more cesareans, delivery can safely happen at home or in the hospital, but not at the birth center. Our accrediting body, CABC, doesn't allow us to attend vaginal birth after 2 or more cesareans in the birth center setting. Now, let's look at the benefits. For baby, while there's a slightly higher short-term risk compared to a repeat C-section, vaginal birth offers beautiful physiological advantages. Passing through the birth canal helps clear the lungs for breathing, kickstarts healthy gut and immune system development, and even supports smoother adaptation to life outside the womb. For the birthing parent, a successful VBAC can mean a shorter recovery, less surgical risk, and a greater chance of future vaginal births. Every cesarean adds a potential complication for future pregnancies, like placenta issues or increased scar tissue. So avoiding additional surgery when it's safe to do so is a real win. So while every person's story and safety factors are unique, VBAC can be an empowering and healing option, one that celebrates the body's ability to do what it was designed to do. Thanks so much for listening. We know that was a lot of information, but we hope that everything we covered, from labs to RhoGAM to VBAC, helps you feel informed and confident moving into the 3rd trimester. We're always here to answer any questions that came up or to talk through anything in more detail, so don't hesitate to ask. This is your care, and we're honored to be a part of it.